Hello everyone, my name is Michael McBatty, and we'll be discussing how to place an ultrasound-guided IV. In today's presentation, I'll discuss the indications for placing an ultrasound-guided IV, steps of how to place an ultrasound-guided IV, possible complications, as well as how to write a procedure note. The indications for placing an ultrasound-guided IV are summarized as an inability to place an IV without the ultrasound. Endurance catheters are particularly beneficial as they can be used for lab draws. In this video, I'll walk you through the steps of placing an ultrasound-guided IV. First, begin by gathering all of the equipment needed. Position the patient and yourself comfortably. It's helpful to place a chuck under the patient's arm. A tourniquet is then placed to help visualize the vessels. This is optional but can help. The skin is prepped. The vein is cannulated and the device secured. Next, we'll go through each of these steps in more detail. The supplies needed include the IV kit, a needle, an 18-gauge extended dwelling endurance catheter is visualized here, an IV tube extender or cap, 2 saline flushes, an alcohol swab or chlorhexidine swab, ultrasound gel, a chuck, and of course an ultrasound. Grasp the tourniquet between your thumb and index finger. Stretch it around the arm, tucking a loop of tourniquet from the top side to keep loose ends out of your working field. Remember to prep the entire arm. Choose the vascular probe and apply gel. Ideal veins should be large, superficial, and have a relatively straight course. It can be helpful to start at the brachial vein and move proximally and distally around the arms. It is important to verify the target vessel is a vein, and to be fully compressible and not pulsatile. Remember to locate the relevant nearby arteries to ensure you do not cannulate an artery. Doppler can be used to confirm the flow of a vessel. Remember to examine both arms to find the best vessel. The needle should be gripped from above rather than below. This allows you to go at a much lower angle of approach to the vessel. Attach the flush to an IV tube extender and flush the tubing. Take the cap off the tubing for easier access and place it in the original packing to keep it clean. The needle is inserted midline using the ultrasound marker as a guide. Once the needle has broken the skin, move your ultrasound probe directly over your needle until the needle tip is visualized. Once you have found your needle tip, advance the needle under ultrasound guidance, moving your ultrasound probe forward to keep the tip of the needle within view throughout. The needle is then advanced until the tip of the needle is seen within the lumen of the vein, at which point there should be a flash of blood in the hub of your catheter. At this point, the angle of insertion should be lowered and the needle advanced just slightly further into the vessel. Also shown here is insertion of IV catheter in the longitudinal view. Once directly above the vessel, you may choose to switch to a longitudinal view of the lumen. This view will ensure that you do not place the needle throughout the back wall of the vessel. Once the needle is in the lumen, the catheter should be advanced. Here, endurance catheter is placed with the return of blood flow. Before removing the catheter, untie the tourniquet and apply pressure approximately to prevent blood loss. The correct placement of the IV can be confirmed by ultrasound. The catheter is followed from the skin until it is visualized inside the vessel. Follow the catheter all the way to the end. With flushing, the catheter and vein will pulsate. Make sure there is no extravagation around the vessel. Ideally, at least 1/3 of the catheter should be intraluminal. It is important to secure the dressing well to prevent accidental dislodgement. Clean any blood or gel, as a wet surface is the most common reason a dressing will not stick. Place the hubcap and apply a double tegaderm over the catheter base. Loop the extender tubing to keep things neat and apply the stabilizing dressing. Apply an IV cap at the end. Remember to always safely dispose of your sharps. Some helpful tips include using plenty of ultrasound gel, making sure the needle is advanced well into the vessel before deploying the wire or catheter. It is helpful to look at the ultrasound screen rather than down at the arm. Avoid applying pressure with the ultrasound as this may compress the vein. Don't place any IV smaller than 20 gauge. It is often helpful to place 18 gauge IVs for volume resuscitation. Some of the complications of IV placement include hematomas, arterial cannulation, thrombosis, thrombophlebitis, extravasation, air embolism, and infection. If a hematoma does develop, apply direct pressure over the site, remove the catheter, apply ice, and have the limb elevated. Remember, always notify the patient's nurse and write a procedure note documenting what type of IV was placed and the location. Thank you for listening.